Good morning, everyone. I'm very happy to be here with Dr. Paulina Sisa, President of the Professional Association of Resident Physicians of Alberta, known as PARA. And also with us today from PARA are Dr. Tamara Yee and Dr. Siyavesh Zarazada, sorry on the pronunciation, and other PARA officials. So one of my top priorities as Minister of Health, a mandate given to me by the Premier, is to address health workforce challenges so that all Albertans have access to timely, high-quality healthcare services no matter where they live. We are taking action on this priority in a variety of ways, with everything from providing over $257 million over 2 years to help stabilize primary care and improve access to family medicine, to implementing recommendations from the Modernizing Alberta's Primary Healthcare System initiative to strengthen primary healthcare across this province. We are also increasing the number of physicians trained in the province, taking steps to increase the supply of nurses, and implementing a new program so nurse practitioners can practice autonomously. Which leads us to today, where Alberta's government is very happy to announce another important action being taken to address health workforce challenges. Alberta's government, in partnership with Alberta Health Services, the University of Alberta, the University of Calgary, and the Professional Association of Resident Physicians of Alberta, PARA, have reached a tentative 4-year compensation agreement for resident physicians in Alberta. Resident physicians are truly critical to the healthcare system, representing the future of medicine in our province. Resident physicians are those who have graduated medical school but are completing postgraduate training in a residency program to obtain their license to practice. And as they complete their training, they are most often involved in a patient's first medical contact in teaching hospitals and clinics throughout the province. With residency programs requiring an additional 2 to 7 years of postgraduate training, most resident physicians spend more than 10 years training to become fully licensed physicians and surgeons. Alberta's government is grateful for all of their hard work and the long hours that they put into completing their training. I'm also very pleased to see that the tentative agreement was reached through collaborative negotiations by all the parties, an agreement that provides fair market, competitive compensation to resident physicians as they train and provide services across this province. The negotiated agreement provides wage increases of 3% in each of the first 2 years and 2% in each of the last 2 years. It also includes market adjustments that puts Alberta on par with other Western Canadian medical schools. The agreement also builds on action our government has taken to improve healthcare in rural and remote communities, including the Rural and Remote Family Medicine Resident Physician Bursary Pilot Program. And this is the program that I announced last week. Up to $8 million will be provided annually for the next 2 years to medical resident students in their final year of an undergraduate medical program when they are matched with a family medicine residency program at the University of Alberta or University of Calgary, or to residents currently completing a family medicine residency at either university, regardless of the year of study. So in return for this bursary, the bursary recipients will commit to delivering comprehensive patient care in eligible communities for 3 years after completing their residency. Alberta is also leading the way in modernizing after-hours coverage for resident physicians through a comprehensive call review. A committee with representatives from PARA, AHS, and the universities will evaluate duty hours, call categories, and best practices to ensure that resident physicians' wellness is prioritized, as well as patient care is safeguarded, and compensation reflects the evolving nature of virtual and home call. So once again, this is a great day for resident physicians and for Alberta's healthcare system. Once fully executed, the tentative 4-year compensation agreement, which is retroactive to July 1st of 2024, and would be in effect to June 30th of 2028. It has been approved by PARA and the AHS board, but still needs to be formally approved by the University of Alberta and the University of Calgary. I am confident that the tentative agreement will provide financial stability for resident physicians as they provide services to Albertans and complete their training. It is a balanced and responsible agreement that will ensure Alberta remains competitive with other jurisdictions, while at the same time providing compensation that will bring medical students and ultimately more physicians to the province. Congratulations to all the parties for reaching this important milestone. And once again, sincere thanks from Alberta's government to the resident physicians across this province. Your dedication to providing quality care to Albertans and starting your new career here in Alberta is very much appreciated. And I just can't say enough of how collaborative it's been working with PARA. They're just an amazing organization. So with that, I'm going to turn it over to Dr. Sisa to come up and say a few words. Thank you.
Good morning, everybody. It's an honor to be here today. And first, before I start, I just want to extend my sincere thanks to Minister LaGrange and the Alberta government for their support in making this agreement possible. It couldn't have been done without you. Resident physicians are the current fabric and future foundation of Alberta physicians' workforce. They are a vital component in maintaining physician numbers and serve as an essential and irreplaceable recruitment tool for bringing new doctors to the province. With this agreement, Alberta positions itself as an attractive destination for resident physicians across Canada. By enhancing comprehensive compensation, as well as training and working conditions, we are ensuring that Alberta continues to recruit and retain the brightest medical talent to serve our communities and contribute to meaningful healthcare reform. This agreement is about more than compensation, however, and reflects months of hard work and collaboration, collecting data and reviewing research, and demonstrates our shared commitment to supporting the future of healthcare in Alberta, our resident physicians. Resident physicians in Alberta want to be part of the solution. We are focused on building a healthcare system that serves all Albertans, one that is sustainable, where physicians are well supported, and where patient care is always the priority. A system that we all want to work in. One of the most significant steps forward in this tentative agreement is Alberta's leadership in modernizing after-hours coverage for resident physicians. A comprehensive review will evaluate national and international best practices to ensure that resident physician wellness is prioritized, patient care is protected, and compensation reflects the evolving nature of after-hours service. This effort is key to creating a sustainable model that both supports our physicians and our healthcare system. In this regard, a sincere thanks to our partners at Alberta Health Services, as well as the universities Alberta and Calgary, for their openness, their flexibility, and courage to explore the fundamental changes that are needed to protect physician well-being and ensure high-quality patient care. Of course, Alberta, like many provinces, are facing challenges. The healthcare system is complex and it's under significant strain and uncertainty at this time. But what sets Alberta apart and what makes us unique is the shared commitment we all have to tackling these issues head-on. We're encouraged by the government of Alberta's investment in building a strong and sustainable workforce. While there's still work to be done, PARA is committed to working together as we continue to build a healthcare system that we can all be proud of. With this agreement, we're taking real steps toward creating a healthcare system that is stronger, more resilient, and ready to meet the challenges of tomorrow. Thank you.
We'll now open the floor to questions from the media. If you could please state your name and outlet, and we will be taking one question and one follow-up today. We can start here in the room if we have anyone today. We just have a microphone at the back, sorry.
Tiffany from the CBC French, Radio Canada. Just to start, last year in spring 2023, we had trouble attracting residents in the province. I'm wondering, has the situation improved, and how much is the new agreement going to improve the situation if it hasn't?
Well, the issue was the matching, and so we're looking to resolve those particular issues. I know timing of the matching is also an issue. The number of residents wanting to go into family medicine was also a bit of a concern as well. Eventually, we did get those positions matched. We are not seeing the same level of issues this current year as we did in previous years. And I think this will go a long way to really incentivizing residents to look at Alberta as an attractive place to come and practice, because they will have, fair compensation, as well as we're looking at their overall well-being while they are a resident. I know there's excitement, and I'll turn it over to Dr. Sisa to perhaps comment as well from what she's hearing from her colleagues since we announced the bursary program and this tentative deal. So.
Thank you, Minister, and thank you, Tiffany, for the question. As Minister alluded to, there is a great deal of excitement in our resident body with regard to the bursary program. I was actually in one of my academic half days with my family medicine colleagues and was able to share the news after the press release came out, and everyone was just wild with excitement. We know that resident physicians who train in Alberta, 70 to 80% of them remain in the province to practice. Our barrier previous to this agreement was our compensation, and now that's been rectified. The rest of the practice of medicine in Alberta is by far and away way more competitive than the rest of Canada. I can speak to that personally after practicing clinically in many other provinces. Our system here is incredibly comprehensive. Practicing medicine here puts the patient first, and we have incredibly collaborative partners. So I think at this point, because we're in the middle of the CARMS match at the moment, this equips us with the information that we need to attract really incredible medical talent to our province and retain them here too.
And a follow-up for the Minister, where are you at with the compensation model for doctors and AMA? Because it sounds like they're not happy with you and launch a campaign that you're not listening.
Well, the primary care model, the physician primary care compensation model that we've been working on with the Alberta Medical Association, it is the reason why last November, I believe it was, we signed a memorandum of understanding that we would work towards a new model. But in the interim, the government provided, through my ministry, $257 million over 2 years to stabilize family medicine as we work to this new model. We knew it wouldn't be quick. We did a lot of extensive work. We announced that we had the framework in the spring. From that, it went to market review, and so that review's been completed. It's come to myself to look at. There's a number of areas that I still have to determine, but as we move forward, I anticipate that we will be able to bring this forward very quickly. But again, I can't say it's going to happen this minute, but we are in the process. I'm completing the processes that I need to do to make sure it is sustainable. Because one of the issues is we want to make sure that this is a successful and sustainable program. I think I've given examples in the past where we had brought forward a blended capitation model. It cost the government millions of dollars to put the IT systems in place, and yet we had very low uptake from physicians. In fact, we've only had about 18 actual physicians on that whole program of the roughly over 11,000 physicians we currently have in the province, and of which 5,600 are family physicians. So we want to make sure that it is sustainable and successful.
But do you have a time? Because it sounds like every time we're saying it's later.
Well, we are working as quickly as we can to get that completed, but there are processes I have to go through.
Just a question for the Minister just over here.
Sure.
Mark Landy with CTV Calgary. We are just hearing some more details here. Just 1 second here. This is from Edmonton. Doctors in Edmonton are telling us that hospitals in the Edmonton zone are over capacity, with general internal medicine operating at 130% capacity and having to turn away patients. Are you aware of this situation, and what are you doing to rectify that?
Well, Alberta Health Services has processes in place as soon as we get into overcapacity situations. Right now, they're opening surge beds, so I was in contact just even yesterday with the CEO of Alberta Health Services, and so they're looking to open surge beds. They're looking at reinforcing the workforce as well to make sure that we have the right complement of doctors, nurses, et cetera, as we open those beds. And they are monitoring it very closely, and if need be, then those surgeries get transferred to other hospitals, et cetera. So this is something that is done on an ongoing basis between the hospitals, et cetera. That is all part of the planning when there is pressure on the system. But we are monitoring it very, very closely.
Just another question. Those on the front lines are telling us they're particularly worried given the time of the year, the expectation they'll see a surge of cases with COVID and flu season underway. What's your plan for the next 30 to 60 days to ensure Albertans can access acute care when currently we have no beds or space to care for them safely? Are we prepared to mobilize COVID-era field hospitals as well?
Well, at this point in time, we are anticipating that we'll have a flu season very similar to last year. And so there's been preparations ongoing. There's, as I just said, there's procedures in place, policy in place to ensure that we have the capacity that we need. That includes opening surge beds, reinforcing the workforce, adding more doctors, nurses, healthcare professionals that as they're needed across the province in the areas that they're needed. Also, we look at how patients are transferred. If we have patients in hospitals in our urban areas that are over capacity, is there a possibility of reallocating them back to their home communities if in fact they're able to go back to their home communities? So we look at all those options, and Alberta Health Services, this is something they do on an ongoing basis, so they do have those policies and procedures in place. But there is no expectation that we would need a field hospital at this point in time.
Move to the phones. Operator, can you put through our first caller?
First question is from Shalon Skalski from CTV News, Edmonton. Please go ahead.
Hi, thank you so much for taking my question. It's actually following up directly from my colleagues. Where are these doctors and nurses going to come from? Because I'm hearing from doctors on the front lines here who say that we don't have the resources to staff extra beds. And this is coming at a time, particularly in the context of, I think, as early as tomorrow, the UNA could be voting to strike. I imagine that would also cut into the workforce. So how is that factoring into the plan and where do you expect these additional workers may come from?
Well, we look at Alberta Health Services has access to locum physicians from other locations in the province that they can move around, as well as nurses that are available perhaps on a casual basis or in a part-time that they could ask to increase their hours. There's lots of strategies in place. There's also agency nursing that we can tap into in the nursing population. I know that I'm hopeful with the announcement of this agreement that we'll have many more agreements that are settled collaboratively across the province. But before an actual strike could take place, there actually has to be an agreement in place, basically making sure that we have the coverage that we need across this province. It's an essential service agreement, I believe, that would have to take place between Alberta Health Services and UNA. And so there will be lots of strategies. There's a lot of thought given into ensuring that we have the workforce that we need at the time that we need it.
Yeah, just as a follow-up, I've heard some criticism from doctors who say the province has been quite muted on the vaccine rollout and any sort of awareness campaign, saying that this is a really important tool to help to decrease those hospitalizations and help with those surges. Will the province be rolling out an awareness campaign to encourage Albertans to get their flu or COVID shots, and if not, why?
Well, we rolled out a very extensive one last year. We probably spent more than we had in the previous number of years on awareness, and we will do the same this year. We are continuing to do the same. We're continuing to get the message out. We have been obviously waiting for Health Canada to approve the vaccines that will target the specific strains of illness that we expect to see, viruses that we expect to see. this year. And now that that has occurred, we are assured that we will be getting our supply in time to start vaccinations as early as the 15th of October. I know that there's opportunities to book your appointment right now, so anyone who's interested should really talk to their health care provider, their primary care provider, or go online and book your appointment.
Thank you. Operator, can you put through our next caller?
The next question is from Jennifer Lee, CBC News. Please go ahead.
Hi, thanks for taking my question. And this one's about vaccine distribution to community medical clinics. So as you know, there's no publicly funded vaccines being shipped to these clinics because there's no distributor in place. And, you know, that sparked concern about access at a time when immunization rates are dropping. So the contract with the distributor expired months ago, sort of back in April, and the government's request for an expression of interest was posted in August. So I'm wondering why it took so long for that to happen, for steps to be taken to find a distributor so vaccines could go to these clinics in time for the fall immunization campaign, and so that doctors could distribute other publicly funded vaccines as well.
Well, my understanding is that the reason why the contract was not renewed was because of quality and safety issues with that particular distributor, and so there is a process that we have to go through in government to have a competitive RFP process that has to be gone through, and so that has been gone through. And my understanding is that at this point in time, we are looking to supply those roughly 250 clinics with the product, but we have over 2,000 access points for immunization that are available across this province. Those clinics represent roughly about 5% of the overall immunization that we provide across the province, and it is very important, and so we are working actively to make sure that they do have product via a different route. But at this point in time, as I say, the contract did end with that distributor because of a safety and quality issue.
Okay, but I'm still wondering why it took so long. Like it's been months. So the contract ended in April. It's now October, and there's no distributor in place. That RFP process was posted. It was posted as an expression of interest. Occurred, it looks like, in August. So what took so long?
Well, that is something that I'm looking into as well. But in the meantime, I want to make sure that people have access to immunizations, that want immunizations. And so we're looking to see how we can get those clinics the product that they need to distribute. But in the meantime, we know that we do have over 2,000 other clinics and facilities that are able to immunize. So there is lots of choice in the province, but we are looking into how we can get those clinics, that roughly 250 clinics, the product they need.
Thanks, Jen. Operator, can you put through our another caller, please?
There are no, excuse me, there are no further questions at this time. Please proceed.
Okay, that ends today's news conference. Thank you.
Thanks, everyone.